are available today for obese patients, which includes the one which you are an expert in? What kind of treatments are available for obesity?
All right. The treatment options are very well known. Every overweight person knows it. It's diet, exercise, a bit of medicines, and the surgery. Now, the diet is not in terms of a short spell of going on a diet.
Okay.
That's not a treatment. So, if you are talking of diet, it has to be a long-term change in eating pattern, which remains lifelong. Otherwise, there is no use of going diet for 6 weeks or 6 months, because the moment you stop a diet, the weight will come back. Same thing applies for exercise. Joining a gym for 3 months, that I joined a gym and I'll make sure I work out for 3 months, will definitely lead to loss of weight. But the moment you stop doing those exercises, the weight will come back. So when we talk of treatment, treatment is not in terms of going to a doctor and adopting a diet for some time or going to a gym and doing. You need to think in long term, change in eating habits and change in physical exercises.
Okay.
As far as medicines are concerned, there are very few which are FDA approved. So practically there are no medicines, and again it's the same issue like going on a diet. You take medicines for 6 months to 2 years maximum, and the moment you stop that, the problems start coming back. So effectively, weight loss can happen with any of these three, but 90% or more regain their weight when these measures are stopped.
Before you continue, doctor, when you talk about medicines not being approved by FDA, is it because that they are not reliable? Is it because they are not very safe? And second thing is that is it having any kind of side effects? And is that because why it's not also?
Yeah. So the reason why these medicines don't work is that for control of obesity, you need to have a medicine which has an impact on the brain, which works on your satiety center, which reduces your hunger. And initially all these medicines have a lot of promise, but once they come out in market, their side effects are seen and they are rapidly withdrawn. So there have been medicines which were touted as the best, a miracle drug, and they were found to have suicidal tendencies. There were medicines which had problems with the heart, and there were increased incidence of heart attacks. So they were withdrawn. So very few medicines survive in this field of medicine.
Okay.
And that's a problem area. The physicians do not have much to offer to these patients.
Okay. Finally, when it comes to surgery, what do you think is the promise that bariatric surgery gives general people? And then we'll talk about diabetics.
Okay. The first statement is this surgery is not for all the obese or all overweight persons. This is for a selected group. So it cannot be a treatment, it can never be a treatment for obesity per se.
Okay.
It is only for those who are at least 25 to 30 kg overweight or more. So if you are just 5 to 10 kg overweight, surgery is not for you, or if you are 15 kg overweight, surgery is not for you. Surgery is for a certain level of obesity and above. And why so? Because they are the ones who will find it very difficult to lose weight. These are the people who have joint pains, they have back pains, they even get breathless on walking 50 meters. So one of the measures is exercise is withdrawn. So they are left with only one measure, that's a diet. So for them, the limitation is that they cannot lose adequate weight with just diet.
Okay.
And even if they lose weight, 98% of them will regain weight within 1 year.
Oh.
So it's practically an ineffective treatment for these morbidly obese people. And the other reason why surgery is advised for these is that because of that kind of weight, they also have other diseases which are like complications of obesity. So they are also there, and if they are not offered a reliable long-term treatment, they will end up with complications of diabetes, sleep apnea, infertility, blood pressure, heart failure, which we don't want. So surgery is a good option. Now surgery helps them lose somewhere between 60 to 80% of their extra weight, which is in terms is about 30% of their total weight.
Okay.
Which is substantial. You know, if you are looking at somebody who's 100 kg, the person can lose at least 30 kgs. All right. And if the patient wants, they can maintain this weight long term. There are studies which says that even after 10 years, 90% of them can maintain their weight. So that's a big promise, because if they are able to maintain their weight loss even after 10 years, they can keep all these diseases like diabetes and all these problems away from them for at least 10 years. Many of them are able to maintain it 20 to 30 years down the line, and probably they can keep these diseases. So it's a big issue for these people who have at the moment no other option for their treatment, no other choice.
Okay. Is there any side effect or the bad consequence of having bariatric surgery?
Certainly. I mean, there is no doubt that bariatric surgery can have its own set of side effects or complications. Okay. Right? Nobody can take it away from surgery. If you operate, you are bound to have those problems.
Okay.
But they are identified, their scientific solutions are available, and their incidence has gradually reduced to somewhere about 0.05 to about 1%. But the benefit overcome the possible side effect. The benefit is to those 99 or 99.5% patients, while the complications or side effects are limited to less than 1% patients.
Fascinating. Now, doctor, tell us, how many of your patients are not even diabetics first, even when they walk into your clinic?
Okay.
Are they already diabetic?
Yes. So at the moment, we see what patients we see in our clinic. Almost 20 to 25% of them are already diabetic. So we have a situation where we are dealing with people who are overweight, and obviously diabetes incidence is higher in them. Or we get patients who are diabetic, who are not overweight, who are coming to us for diabetes treatment. So obviously my percentage in my clinic will be higher than what you see in the general clinics. But it would be anywhere between 20 to 30%.
And would they also include type 1?
Very rarely. We have type 1 diabetic who are overweight. Generally type 1 diabetics are thin guys. So when somebody walks in who says, I am diabetic and I want to get a treatment, I ask them, are you type 1 or type 2? They always know what they are. So it's very rare that a type 1 diabetic will come to us. Especially in a city like Mumbai, education level is higher, awareness level is higher. People know that this treatment only works for type 2 diabetic.
Okay. Now in case of diabetics, can they be treated just like any other obese person, or you have to take special care of them because of their diabetic condition?
Yeah. So if somebody is diabetic and is obese or non-obese, we need to make sure, we need to do a few things. We need to check out whether this is definitely a type 2 diabetic, or is it a type 1 diabetic and it has not been identified yet. So we need to exclude type 1 diabetes first. Second thing, we need to find out whether their pancreas are still functioning or not. Fortunately now, physicians put most of the patients on insulin early, even in type 2 diabetic, because the pancreas is an important organ. So even if the patients were on insulin for say 5 years, 10 years, 15 years, may still have functional pancreas if they are type 2 diabetic. So if they have functional pancreas, the surgery can work. Third thing is that we need to find out what will be the outcome of the surgery, and we can give that outcome to the patient even before surgery, that there is 80% possibility that your medicines will stop, 100% possibility or 60% possibility we can prognosticate even before surgery with the tests. And then the last is, obviously if we are going to operate, we need to make sure that these people are controlled diabetic. So they go to a physician who makes sure that they are put on adequate treatment for control of their diabetes.
Dr. Goel, when you talk about diabetics in particular, does it also happen that it can also help type 2 diabetics just to cut down weight? I mean, leave alone the issue of the drugs related to diabetes, because that itself helps the diabetics in the long run. just to cut the weight.
Yes, primarily bariatric surgery came for reduction of weight.
Exactly.
Diabetes thing came very recently. 2008 we started this in India.
Correct.
So what we are doing is an afterthought. Initially it was for weight loss. So now there are two things what you're asking. One is if they lose weight,
Only the weight.
it helps them. Yes, their
Absolutely.
requirement goes down, their insulin resistance goes down, they are better patients. On the other side, look at it, most of the diabetic medication leads to weight gain. So if their diabetes is controlled after surgery, the possibility of weight regain is much less.
Oh.
So whether it's insulin or almost 80% of the diabetic drugs leads to weight gain in these patients. So that also helps, yeah.
Okay. Now, when it comes to the how much weight can they lose on an average when you're when people visit your clinic? First of all, non-diabetic and even diabetics. You say about 30% of your weight.
Yeah.
Now, that can be applied even to the diabetics.
Yes, it's the same.
It's the same.
It's the same. Typically, patient loses 10% of their weight in first month. So if somebody is 100 kgs, the person will lose 10 kgs in first month. If somebody is 200 kgs, they will lose 20 kgs in first month. They are diabetic or non-diabetic. And then they lose about 5% every month.
Okay.
So they would be losing anywhere between 5 to 10 kgs every month, depending on their initial weight. Yeah.
Okay. Can you just explain what exactly is this surgery about? Because there is so much of, mystery behind it. It's almost like a Hollywood movie where...
No. I think people know it. The misconceptions are because people talk to guys who do not understand this surgery and they create a feeling of scare.
No, it's not about the scare, but it's actually a miracle thing.
No, it's not a miracle. It's very scientific. These surgeries are being done for more than 60 years worldwide. And I do understand that people had negative thoughts about it, but that also led to a lot more research about these surgeries. And there are now thousands of publications worldwide from scientific community. And there is hardly any single publication which criticizes these established surgeries. What we do in this surgery is like this. An adult has a stomach capacity of about 1 liter. So when we have a hearty meal, we don't have a hearty meal every day. We try to avoid it as we grow senior. The day we have a hearty meal, we eat about 1 liter of food. And then we say, we are full, I can't eat anymore.
Okay.
All right.
Okay.
Now imagine a child who is 1 year old, whose stomach capacity is about 100 ml. He also has a hearty meal, which is only 100 ml.
True.
So he is satisfied with 100 ml of food. An adult is satisfied with 1 liter of food.
Okay.
Both are satisfied. So what we do in all kinds of bariatric surgery, there are n number of bariatric surgery, almost 16 types of bariatric surgery, is we reduce this 1 liter stomach to a 100 ml stomach capacity. Now this patient who is an adult has a stomach like child's stomach. He eats 100 ml of food or whatever and is absolutely satisfied like that child who was 1 year old. So we have given a situation where a person eats a very small meal and is happy. This is what the dietitians want, what the nutritionists want. When you go to a nutritionist for weight loss, they say don't eat 1 liter of food, eat only a piece of fish or eat only 1 chapati and you will lose weight. But then you don't get satisfied because your stomach is empty. So they ask you to eat a plate full of salad before each meal because it doesn't have calorie, it has very less calorie and it fills up the stomach.
True.
Now you come to a situation where you don't need to eat that plate full of salad ever. If you love it, I don't mind. But you can eat your fish, chicken, eggs, mutton, vegetables, fruits, breads, rice, whatever you wish. The quantity is as small as the dietitian wanted it. So you are bound to lose weight. And this remains small. It marginally increases, but it remains small. And so you will lose substantial weight and you can maintain it long term.
Essentially, you're saying that the capacity of the stomach will go down by
Yes, yes. That's the prime reason for weight loss after surgery.
And over a long time, what happens? Does the size come back?
Yes. So now the stomach enlarges. It has to enlarge. If it doesn't enlarge, the person will keep on losing weight and will become malnourished or underweight after a year or two. So what happens is that this is a God-gifted situation, that this small stomach that we have created enlarges marginally. Maybe it becomes double its size. So let's say originally we said 1 liter, now it's 100 ml. It can go up to 250 ml. It can never become like 1 liter. So now the person is able to eat a decent size meal and feels full with that and gets enough calories to maintain his weight. Okay? But this is still about 1/3 of the original size of the stomach.
True.
So if the person wants, he can maintain the weight. The problem is, if in this 1/3 meal, the person eats a calorie-dense meal each time, then he can have enough calories to regain his weight. So if in place of having a normal meal of let's say a vegetarian meal, let's say dal, rice, chapatis and vegetable, in place of that, if he's eating dal makhani and chapati with butter on it and or biryani every day, the weight will come back. But if the person eats normal meal every day and maybe 2 to 3 times a month, even if he eats fried stuff or sweets, weight will never come back.